Welcome to the Bellytail Podcast. Stories that connect, inspire, and move you forward. Here, every tale brings a spark of understanding, a fresh perspective, and a little more light to the journey we're all on together.
Welcome back, everybody, for another deep dive. This time we're going to be taking a look at insomnia. You sent in this excerpt from the Cleveland Clinic's website.
Yeah.
And our goal is to really help you quickly grasp the key facts about it.
Okay.
Like what it is, what causes it, the potential risks, and importantly, how to manage it.
Right.
And, it's fascinating. This excerpt says that 1 in 3 adults worldwide experience insomnia symptoms.
Really?
Which means, statistically, there's a pretty good chance that one of us in this conversation right now has probably dealt with it at some point.
It's definitely something that a lot of people experience.
Yeah.
And yet there are still so many misconceptions about it.
Okay, so let's unpack that.
Okay.
What is insomnia, really?
Yeah.
Is it just about not getting enough sleep?
Right.
Or is there more to it?
Yeah, it's actually more nuanced than just not getting enough sleep.
Oh.
The Cleveland Clinic explains that insomnia is really about how this lack of sleep impacts how you feel and function during the day.
Wow, so it's not just about feeling tired.
Right.
What kind of impact are we talking about here?
Yeah, the effects can be pretty far-reaching.
Okay.
Think mood swings, difficulty concentrating,
Yeah.
even problems with memory.
Wow.
It can even affect your reaction time,
Oh, wow.
which is a safety concern, especially when driving or operating machinery.
Yeah, no kidding.
Yeah.
That's unsettling to think about.
Yeah.
Now, the source material mentions different types of insomnia.
Yes,
Can you elaborate on that a little bit?
absolutely.
Okay.
There's acute insomnia, which is short-term
Okay.
and often triggered by stress or a specific event.
Gotcha.
Then there's chronic insomnia, also known as insomnia disorder,
Mm-hmm.
which is long-term and considered a medical condition.
Okay.
And it's this chronic form that affects roughly 10% of the world's population, according to our source.
So how do you know
Ye-
if you're dealing with just a rough patch of sleep? Right. Or if it's actually chronic insomnia?
Yeah.
What are the, telltale signs?
Well, the source dives into the specific symptoms.
Okay.
And it's interesting because there are actually 3 main ways people experience difficulty sleeping.
Okay.
You might have trouble falling asleep initially.
Right?
You might wake up in the night and struggle to fall back asleep.
Yeah.
Or you might wake up too early and not be able to doze back off.
That's a good distinction.
Yeah.
I think a lot of people can probably relate to at least one of those scenarios.
Mm-hmm.
But I'm guessing with chronic insomnia, there's more to it than just those sleep disturbances, right?
To be considered chronic insomnia, the sleep difficulties need to occur at least 3 nights a week for 3 months or longer.
Wow. Okay.
And they need to be accompanied by those daytime impairments we talked about earlier,
Yeah.
like problems with mood, concentration, or energy levels.
So it's really the combination of those nighttime sleep issues and their impact on your daytime functioning that signals chronic insomnia.
Exactly.
It's not just feeling tired, it's feeling like you can't fully function because of it.
Right.
So we've talked about what insomnia is,
Yeah.
but what's actually going on in our brains and bodies that causes it? Is there one clear culprit,
Right.
or is it more complicated than that?
It's definitely more complex than a single cause.
Right.
The Cleveland Clinic explains that while research is ongoing, multiple factors can contribute to insomnia.
Okay.
They list things like genetics,
Huh?
meaning some people are simply predisposed to sleep problems,
Okay.
differences in brain activity,
Yeah.
underlying medical conditions,
Right.
mental health conditions,
Mm-hmm.
stressful life events, or major changes.
Gotcha.
Even our personal habits can play a role.
So it's like a perfect storm of potential contributors
Exactly.
out of that whole list.
Yeah.
What's the one that jumps out at you as most significant?
What's fascinating here is the connection between insomnia and mental health.
Oh, really?
The source points out that about half the people with chronic insomnia also have at least one other mental health condition.
Okay. That's a pretty strong link.
It is.
What do you think is going on there?
Yeah.
Is it that the mental health condition makes it harder to sleep, or could it be the other way around?
It's likely a bit of both,
Okay.
a bit of a chicken and egg situation.
Yeah.
Mental health conditions like anxiety and depression can definitely disrupt sleep.
Right.
And then lack of sleep, in turn, can worsen those mental health symptoms.
Oh, wow.
It creates this vicious cycle.
It makes you realize how interconnected our mental and physical well-being really are.
Absolutely.
The source also goes on to list some additional risk factors, like being a light sleeper or using alcohol before bed.
Right.
I've definitely heard that alcohol can disrupt sleep, even though it might make you feel sleepy initially. Like,
Yeah.
what's going on there?
Alcohol might help you fall asleep faster, but it actually interferes with the quality of your sleep later in the night.
Oh.
It disrupts your sleep cycles and can cause you to wake up more frequently.
So it's a bit of a false friend when it comes to sleep.
Yes.
Now, the source material doesn't shy away from the potential risks associated with severe or long-lasting insomnia, particularly because it leads to sleep deprivation.
Right.
It sounds like they're saying insomnia itself isn't inherently dangerous,
Yeah,
but the consequences of not getting enough sleep can be pretty serious.
absolutely.
Okay.
The Cleveland Clinic highlights the connection between sleep deprivation and an increased risk of heart attack,
Oh, wow.
stroke,
Gee.
even type 2 diabetes.
Wow, okay.
And it can worsen existing conditions like depression.
That's a pretty compelling reason to prioritize sleep.
Definitely.
It's not just about feeling our best, it's about protecting our long-term health.
Exactly.
So let's shift gears now and talk about what people can actually do about insomnia. The source material mentions several treatment and management approaches.
Yes.
What's usually the first line of defense?
The Cleveland Clinic really emphasizes the importance of good sleep hygiene.
Okay.
It's often the foundation for managing insomnia.
I think a lot of people hear sleep hygiene and think it's just about having a comfy bed in a dark room.
Yeah.
But it sounds like it's much more comprehensive than that, right?
Right.
Uh,
It's really about creating an environment and a routine that promote good sleep.
Gotcha.
For example, the source talks about setting a regular sleep schedule.
Uh-huh.
That means going to bed and waking up around the same time each day,
Okay.
even on weekends.
Yeah.
It helps regulate your natural sleep-wake cycle, which is your body's internal clock that governs your sleep patterns.
That's the one I struggle with.
Oh, yeah.
I tend to stay up late on weekends, and then come Monday morning, I feel completely out of sync.
It's a common trap,
Yeah.
but even a slight shift in your sleep schedule can throw off your internal clock.
Oh, no kidding.
The source also recommends creating a relaxing bedtime routine to help signal to your body that it's time to wind down.
So things like taking a warm bath,
Mm-hmm.
reading a book, maybe listening to some calming music,
Right.
anything that helps you de-stress and transition into sleep mode.
Exactly.
Okay.
And they're really adamant about limiting screen time before bed.
Right.
The blue light emitted from electronic devices can actually suppress melatonin production,
Uh-huh.
which is the hormone that helps regulate your sleep-wake cycle.
It's amazing how much our technology can interfere with our natural sleep patterns.
It really is.
But what if you've got a great sleep routine in place?
Yeah.
And you're still struggling?
Right.
The source also mentions medications as a treatment option.
Yes.
Okay.
There are various medications that can help with sleep,
Okay.
both prescription and over-the-counter.
Mm-hmm.
They range from benzodiazepines,
Uh-huh.
which work by enhancing the effects of a calming neurotransmitter in the brain,
Okay.
to non-benzodiazepine hypnotics,
Mm.
which target specific sleep receptors.
Gotcha.
There are even some antidepressants that have sedating effects and can be used to treat insomnia related to mood disorders.
That's interesting.
Yeah.
So there are different types of medications that work in slightly different ways.
Right.
Are there certain ones that are more commonly prescribed than others?
It really depends on the individual's specific needs and circumstances.
Okay.
What's important is that you always consult with a healthcare provider before taking any medication for insomnia.
Yeah, for sure.
They can determine the best option based on your medical history, the potential side effects,
Uh-huh.
and other factors.
So it's not a one-size-fits-all approach, which makes sense.
Right.
And the source also reminds us that medication is just one piece of the puzzle, right?
Right.
Okay.
It's crucial to address any underlying mental health conditions that could be contributing to insomnia.
Mm.
If anxiety or depression, for example,
Yeah.
are interfering with your sleep. Treating those conditions with therapy or other forms of mental health care can often improve your sleep as well.
So sometimes the key to better sleep lies in addressing those deeper emotional or psychological factors that might be at play.
Absolutely.
That brings us to the topic of prevention.
Okay.
Is there anything we can do to avoid insomnia in the first place, or is it just something some people are predisposed to?
The Cleveland Clinic acknowledges that you can't entirely prevent insomnia,
Right.
but there are definitely things you can do to reduce your risk.
Okay.
As we've discussed, practicing good sleep hygiene is a great place to start.
So all those things we talked about, consistent sleep schedule,
Yeah.
relaxing bedtime routine, avoiding screens before bed, those are our best bets for staying ahead of insomnia.
They're definitely a great foundation.
Okay.
And the source also emphasizes that most cases of insomnia are not a major concern, and can be effectively managed with lifestyle changes and Ingo treatment.
That's reassuring to hear. But they do urge listeners to consult a healthcare provider if they have concerns about their sleep.
Absolutely.
When would you say it's time to seek professional help?
If you're experiencing persistent sleep difficulties,
Okay.
especially if they're impacting your daily life and you've tried making changes on your own,
Right.
it's always best to seek guidance from a healthcare professional.
Mm-hmm.
They can help determine if there's an underlying medical or mental health condition contributing to your insomnia
Right.
and recommend the most appropriate treatment options for you.
So it sounds like the key takeaways here are that insomnia is more common than we might realize.
Yes.
It's not just about feeling tired, but how that lack of sleep affects our daily lives. And there are effective ways to manage it,
Yeah.
whether through lifestyle changes, therapy,
Yeah.
or in some cases, medication.
Yeah, and it's important to reiterate what we talked about earlier about the potential dangers of sleep deprivation.
Yeah.
It's not just about feeling groggy.
Or having a less than productive day.
Yeah.
It can have some pretty serious implications for our long-term health.
Precisely.
Yeah.
While insomnia itself may not be inherently dangerous,
Right.
the consequences of chronic sleep deprivation
Yeah.
definitely something to take seriously.
For sure.
It really underscores why prioritizing sleep is so important
Mm-hmm.
for our overall well-being.
Well said. Now, before we wrap up this deep dive on insomnia,
Okay.
I want to leave our listeners with something to ponder.
Right.
We've covered a lot of ground today about what insomnia is,
Mm-hmm.
what causes it,
Yeah.
and how it's treated.
Right.
But now I want to bring it back to you
Yeah.
and your own sleep habits.
Mm-hmm.
Thinking about all the factors we've talked about
Yeah.
that can disrupt sleep.
Mm-hmm.
What aspect of your routine might you want to explore further? Maybe it's your caffeine intake,
Right.
that late night screen time.
Mm-hmm.
Maybe it's time to finally establish that consistent sleep schedule we talked about.
That's a great question to consider.
Yeah.
Sometimes even small changes can make a big difference in the quality of our sleep.
Exactly.
Yeah.
And remember,
Mm.
prioritizing your sleep is an investment in your overall health and well-being.
Absolutely.
So sleep well and sweet dreams.